State offices used for bedrooms. That's what some children in the Texas foster care program were having to do. Tuesday, an update on legislation preventing that practice was provided by Jamie Masters. She is the new commissioner for the Department of Family and Protective Services.
I took that to heart and can tell you there are no children in DFPS offices.
Members of a special Senate committee on Child Protective Services wanted to know more about the reforms made during previous legislative sessions. The state foster care program is shifting from a large Austin-based bureaucracy to what's called community-based care. The idea is to give local communities more say and more ownership in foster care. But the transition is far from over.
If it's not implemented, what are the consequences? Well, the consequences for the child is pretty obvious. They might die.
Since 2020, 100 children have died in the state's welfare system, and most have been attributed to, quote, pre-existing medical conditions. And so we need to make sure that things can be caught quickly. And if they're coming in to our care, it is our obligation to know what their health baseline is as we receive the children, and what do they need for their own welfare.
To address that, every child in foster care is to have a medical screening within 3 days of entering the program. There is also a 24-hour notification rule for any doctor who treats a foster child when a relocation happens.
So we've passed great bills. Are they really being implemented? What's your answer to that?
It is still up to the caseworker to do their part.
Addressing that people problem, the committee was told, will require a technology fix.
So a caseworker can't just go into our current class and impact system and just say the child is here. They have a whole dissertation worth of information that they have to enter in with that. And when they're going from visit to visit and they're in their car, and sometimes they're in places with no access to internet, and just the struggles that come with them being able to do that in a timely manner is something that we are trying to address with our current IT system.